In cardiovascular physiology, a key terminologies are related to heart volumes. When you try to understand clinical conditions like heart failure, or as a medical doctor decides if surgery or medicine is good, some key heart volumes are important to be understood by you. There are five key heart volumes, beginning with cardiac output, stroke volume, end diastolic volume, end systolic volume, and ejection fraction. Let's begin with the first, cardiac output. If you look at the heart beating, that is the ventricles pumping the blood across the pulmonary and the aortic valve, we get that is a specific amount of blood specially pumped by the left ventricle. But cardiac output is defined as the amount of blood ejected by each ventricle per minute. Remember, it is not by both the ventricles, it is by each ventricle. It is also called as minute volume since we are considering the output per minute and the normal value is 5 liters per minute. The second terminology is stroke volume. Stroke volume is very similar to cardiac output because it is the amount of blood ejected by each ventricle per beat. The only difference is the first was per minute, so stroke volume is per beat, whereas cardiac output is usually expressed per minute. The normal value here is 70 ml. Cardiac output now can be derived because we know that stroke volume is per minute and the heart rate describes the number of times the heart beats. So if you multiply stroke volume with heart rate, we get cardiac output. For example, if the stroke volume is 70 ml and the person's heart rate is 70, we get 4900 ml or 5 liters as the cardiac output. The third terminology is end diastolic volume. It is the volume of blood present in the ventricle at the end of diastole, which is relaxation. Once the atria pumps all the blood into the ventricles actually are relaxed, receiving blood. As the atrioventricular valves close, there is a specific amount of blood remaining in the heart after or at the end of diastole. The heart has not started to contract, that is why it is called end diastolic volume. The normal volume is approximately 135 ml plus or minus 10 ml. The next volume is end systolic volume. As you know, at the end of diastole, the heart is still relaxed and it starts to pump and eject blood. Once it has completely ejected the blood out, there is a closure of all the valves, the AV valves and the pulmonary and aortic valves. So end systolic volume is the volume of blood present in the ventricle at the end of systole or contraction when all the blood is left out. As the end diastolic volume was approximately 135 ml, we find that normal value of end systolic is 65 ml. That means about 70 ml is now ejected out. This ejected out blood is called as stroke volume, which we can attain by having end diastolic volume 135 ml in our example minus end systolic volume 65 ml in our example, giving to 70 ml. So that brings me to the last key terminology, ejection fraction, which is very similar to stroke volume. If we take the stroke volume and take it as a percentage of end diastolic volume, we get ejection fraction. That is what fraction of the blood is ejected out of the end diastolic volume. We can take ejection fraction equals stroke volume divided by end diastolic volume into 100%. This is a very important concept we need to understand, especially in heart failure. We get heart failure with preserved ejection fraction, heart failure with reduced ejection fraction. The normal value of ejection fraction is 65%. During exercise, this ejection fraction can increase to 85 to 90%, and during heart failure, it gets reduced to 25 to 40%. Two bonus terminologies for you related to the earlier discussed terminologies. If you look at a small child or compare that with an adult, we get that the cardiac output is different depending upon the size, the height or the weight of the individual. So we have got cardiac output expressed per unit surface area, that is the body surface area, is called as cardiac index. It is considered as a better indicator of cardiac function as it's specific, it does not change with the size or body surface area. The cardiac reserve, if we compare your cardiac output which is required or the maximum cardiac output which is needed, let us say when you are sleeping or in resting position like standing, compare that with a position like exercise. You are exercising, strength training, aerobic or anaerobic exercises. We can compare the maximum cardiac output in both these, and the difference between the maximum cardiac output in exercise versus at rest becomes your cardiac reserve. When you exercise regularly, your cardiac reserves improves. That brings me to the summarizing the 5 key heart volumes. Cardiac output and cardiac index, it is the amount of blood ejected by each ventricle per minute. Cardiac index is body surface area specific. Stroke volume is the amount of blood ejected by each ventricle per beat. And diastolic volume is the volume of blood present in the ventricle at the end of diastole, which is relaxation. And systolic volume is the volume of blood present in the ventricle at the end of systole or contraction. Ejection fraction is the stroke volume expressed as a percentage of end diastolic volume. Cardiac reserve is the difference between maximum cardiac output in exercise versus at rest. That's all by the key terminologies. I'm Dr. Mateen from Dr. Mateen Physiology, where we discuss how health happens and how disease happens to help you understand the pathophysiological basis of health and disease. If you enjoyed this video, make sure you subscribe to the YouTube channel, like this video and click the bell icon. See you next time. All the best.